We have time for a short Q&A now. I'll invite those of you who have to either drop a question in the question and answer bar and or in the chat. And just maybe to get the dialogue going, one of the things that you mentioned, Roberto, that I thought was so crucial was the different guidance and support that WHO has provided to so many countries around the world for kind of biomedical inventory guidance and management tools to set up an inventory specifically for equipment related to COVID. And then more from a kind of systems capacity building, you mentioned the priority medical devices. So how do we take what we know we have and see where we should make adjustments with the technologies that we have in our health system to be able to deliver these services. So since there aren't any questions in the Q&A box yet, I might throw out an open question to people and ask you, have any of you in your home countries used the WHO inventory tool as a starting place for getting either a regional or a national overview of your medical devices and health technologies for COVID?
Well, there's deafening silence there, isn't there, Shauna? So I can say from my part in the UK, I'm pretty confident that none of my colleagues have used that guidance. And all the way through that presentation, Roberto, I was thinking, gosh, why haven't we in the UK got systems in place like you've described? It was a very impressive presentation. So firstly, thank you for that. So I can't answer the question that Shauna asked. So instead, I was going to pinch the microphone since that's my role here. And ask you your question, because one of the things that we found in the UK at the very early stages of the pandemic was that we didn't have a national response. We have a national health service, so you might have expected us to have, but we didn't. But we locally, all over the country, we put in place things that we refer to as mutual aid, where local hospitals helped each other in the very early stages in lots of ways. And it was only later that we got a national system helping. Mexico is huge compared to the United Kingdom. So I just wondered if you had a view about how important the national response was versus local responses with individual hospitals helping their neighbours.
I would like to say I'm very well impressed about the presentation of Roberto Ayala. Just to focus briefly on his last insights about lessons learned or next steps. Just one of them, Roberto, this awareness of the useful information to solve health problems. I mean, this is not just a very well and appreciated lesson for Mexico, but for all of us globally, not just big countries with nice developed systems, but low income and medium income settings. This is a very nice and valuable insight for the following discussions. Over.
Thank you. Yes, there was certainly a challenge from gathering nationally the information. As you could see in the chart presented by the Ministry of Health, there was only the information for public hospitals. Private hospitals were not considered, and private hospitals were a very crucial part on provide emergency health services for COVID patients. So if we do the math, probably we have enough ventilators, at least from the private sector, to help them. And we didn't need to buy all that many other ventilators that right now, what are we going to do with them? So yes, it was certainly a challenge. And again, the information should be used for, in this case, for example, for disaster planning. Planning is something that we haven't looked deeply for training and other educational scenarios. So I think that we need to be more conscious that information should be useful for planning and in order to help.
Thanks, Rosanna, for that question, and Roberto for your answer. It was really insightful. And you got me thinking, Rosanna, about how sometimes when we have really sophisticated systems for managing our information, it's great, and other times some of the kind of some of those systems get in the way of us being able to collect and share information quickly because they have requirements built into them that don't serve our purposes. Just before we wrap up this Q&A and move on to the next part of the agenda, we have a couple of people sharing in the Q&A, which is great. So we have Francine, thank you, from Rwanda. You said that you've used the WHO inventory checklist to assess your readiness and gaps, and that it was also good for raising awareness, which is excellent. And then we have a question from Noor, which is what are best practices for equipment tracking inter and intra facility, especially for low and middle resource settings? So again, the question is good practices for tracking equipment both within a health facility and across different health facilities or in the system. Is there anyone who wants to provide their response or their reflections to Noor?
Yeah, I would address that. We're going to talk a little bit about that in a couple of minutes, but we've developed a platform called relinkglobalhealth.org. And that's a look at the marketplace holistically so that you can look at by location, geolocating it. So you might want to look at relinkglobalhealth.org and think about knowing by location what is located in each building that might be available from collaborating with physicians and caregivers as a first step. Just an idea to think about.
Thanks so much, Ray. And now I think I'm going to hand back to my wonderful co-moderator, Dan, to keep the program moving along.
Shona, excellent. Thank you very much. So as I was just mentioning a minute ago, I'm lucky enough to work in the National Health Service, the NHS in the UK. The NHS has, like any health service, has its faults, I'm sure, but it is a national service, and we share many systems and many infrastructures across the whole country. Despite this, at the start of the pandemic, as I've just acknowledged, at the start of the pandemic, we realised we were not as well connected as we thought we were, and our networks weren't as good as we hoped they might have been.